Hi, this is Andrew Garcia doing the subcutaneous medication administration checkoff. So I have my vitamin B12 med sheet and the BMS paper chart for my medication administration record. And I'm going to begin. I'm going to start off by identifying the 3 sites for subcutaneous injection, which is the outer posterior aspect of the upper arm, the abdomen from the costal margins to the iliac crest, and then the anterior aspect of the thighs. And then now I'm just gonna sanitize my hands. And now I'm gonna locate the MAR, and I'm going to check the assigned patient name, date, name, allergies, date of birth. So I have Anna Pawlowski, allergies penicillin, date of birth is 5/5/1957. And after I identify that, I'm just gonna review the entire MAR. So I'm gonna look over all her medications. And now I'm gonna verify the order for subcutaneous injection, vitamin B12. I see it here on the MAR, I verified it. So now I'm just gonna pull the medication. So I have vitamin B12, and I'm gonna do my first check of the 5 rights. So I'm gonna compare it to the MAR. The first check is gonna be the right patient, Anna Pawlowski, and then the right drug, vitamin B12. Correct dose is gonna be 500 micrograms, and then the correct route, subcutaneous injection, and then the right time at 14:58. After I've done my first check of the 5 rights, I'm going to check the expiration date, make sure the medication is not expired. Then I'm gonna consult my drug information for any side effects. It says common side effects are hypertension, erythema, rash, and red urine. Most serious side effect is anaphylaxis. Nursing considerations assess vitamin B12 deficiency, monitor folic acid, vitamin B12 levels, and iron levels. Okay, so I've consulted my drug information, and afterwards I'm going to calculate the correct dose, the conversion. So from 500 micrograms to milliliters, 500 micrograms equals 0.5 milliliters. So I have my conversion 0.5 milliliters. And once that's done, I'm going to select the correct syringe. So here I have a 1 milliliter 25 gauge 5/8 syringe, and after I've selected the correct syringe, I'm going to do my second check. So again, I'm going to compare it to the MAR. Right patient, Anna Pawlowski, right drug, vitamin B12. Right dose is going to be 500 micrograms or 0.5 milliliters, and then 500 micrograms, 0.5 milliliters. And now the right route, subcutaneous, and the right time, 14:58. So after my second check, I'm going to open the medication, and then I would time, date, and initial. So our time, date, and initial. And I'm gonna clean the rubber stopper with an alcohol pad. And now I'm going to open the syringe, correct? And I'm gonna withdraw 0.5 milliliters of air. And now I'm gonna insert it into the center of the rubber stopper. And I'm injecting it air to air. And now I'm just gonna invert it. And I'm gonna withdraw 0.5 milliliters of the medication. Gonna tap out any bubbles. As you can see, I have 0.5 milliliters of the medication, and I'm gonna safely recap it. Using the scoop method. And I would label the syringe with a barcode. And once I've labeled the syringe, I'm gonna go into my opening procedures. So first thing I'm gonna do is I'm gonna assemble all necessary equipment. Once I've assembled all necessary equipment, I'm going to foam in. So I'm gonna sanitize my hands right here. I'm gonna knock, introduce myself. Hi, I'm Andrew Garcia. I'm your student nurse for today. And I'll be giving you your vitamin B12 shot. Can I have your name and date of birth? It's gonna be Anna Pawlowski, XXXX. And then I will double check on the computer. So Anna Pawlowski, 5/5/1957. Mrs. Pawlowski, do you have any allergies you should know about? So I'll check her wristband as well. And then check the computer. Allergies to penicillin. Alrighty, Mrs. Pawlowski. I'm just gonna set these down. I'm gonna assure her safety. So I'm gonna check the brakes. The brakes are good. And then I'm gonna assure the bed's in the lowest position. And then I'm gonna make sure the side rails are up and that the call light is in reach. And then I'm going to close the privacy curtain and close the door. And now I'm going to complete any prior assessments. So the prior assessments I need for vitamin B12, it just says to monitor vitals. So once I assess for vitals, heart rate, respirations, blood pressure, O2 sats, once everything is within normal range, I make sure. I'm going to teach her about vitamin B12. I'm going to use my med sheet. So Ms. Pawlowski, I'll be giving you your vitamin B12. It's for your vitamin B12 deficiency. Vitamin B12 is a necessary coenzyme for metabolic processes. Its therapeutic class is anti-anemics. And now I'm going to do my third check. So I'm going to use the syringe that I labeled. I'm going to check it against the MAR. So Anna Pawlowski, vitamin B12, 500 micrograms or 0.5 milliliters, 500 micrograms or 0.5 milliliters, and subcutaneous route, 1458 and 1458. All right, patient, right drug, dose, route, and time. Alrighty, once I've completed the third check, I'm going to third check. Oh, I'm sorry. So I'm going to scan, this is my scanner. I'm gonna scan the wristband and I'm gonna scan the medication on the syringe. And I'm gonna select start on the computer. And once I do that, I'm gonna position the patient and the way I can expose the site. So I'm gonna be doing the anterior aspect of the thigh. Here's my injection site. So this is the anterior aspect of the thigh. And once I do that, I'm gonna don gloves. Once I put my gloves on, I'm going to use an alcohol pad and in circular motions clean the area, injection site. And I'm gonna allow it to dry. And afterwards, I'm going to uncap and I'm going to pinch using my non-dominant hand. I'm gonna insert the needle at a 90-degree angle. I'm gonna slowly administer the medication. I'm going to use the gauze to hold pressure, and I'm gonna engage the safety on the needle. The safety would be on. And once I get the bleeding to stop, I'm going to dispose all medical equipment into the trash. So we'll do so. And once I've disposed of everything, I'm gonna make sure I document that the medication has been given. So I document it. I would document any assessments that would have been done, which were the vital signs I've taken. And then after that, I'm gonna assure the patient's safety. So make sure the bed is locked, the brakes are locked, bed's in the lowest position, side rails are up, her call light's in reach, and I'm gonna make sure the patient's comfortable. Mrs. Blassi, are you comfortable right now? Do you need me to do anything? No? Okay. And now I'm just gonna open the privacy curtain and I'm going to foam out. So I sanitize my hand, and that concludes my subcutaneous medication administration checkoff. Thank you.